This is breaking news.
Governor Murphy is giving an update on the coronavirus pandemic in New Jersey. Let's listen in.
At 4,628. And as we can see, the number of hospitalizations across our health systems regionally also continues to trend down. And the rates of hospitalizations regionally are on similar trajectories. And again, we saw more recently, Judy, as you pointed out, the South, this migrated, and you could see that migration in particular in the South. Our field medical stations reported 35 patients last night. And a reminder that the field medical station at the Meadowlands Expo Center is this weekend standing down and its operations transferred to East Orange General Hospital. And to you, Sharif, I want to thank you and the University Hospital team for your partnership, not just in coordinating all of our actions in the north where this hit the heaviest, but also for your partnership at the Meadowlands site. So thank you. Looking at our long-term care facilities, the numbers of positive cases, as you can see here, and deaths, tragically, connected to these facilities continues to grow. However, as we have noted before, we have put in place significant new levels of oversight and resources, and the New Jersey National Guard is deploying some of its members this weekend to several of these facilities to assist in mitigation. The number of patients reported in either critical or intensive care fell again yesterday to 1,416. Judy, you've thought this number, while it's getting better, let's go back to that if we could, is stickier than the number of hospitalizations. So it's going in the right direction, but not at the rate that I think you and I and others would like to see. And ventilator use continues on its downward trend with 1,054 currently in use. And all of us here are hoping that that number may soon fall under 1,000. There were 364 new COVID-19 hospitalizations yesterday, but there were also 422 live patients discharged yesterday, so we continue to see more patients leaving the hospital than entering. However, before you go on, I want to say this. Let's not forget, Judy would want me to say this, we're making a lot of progress. 364 people went into a hospital over the past 24 hours. We are not out of, with COVID-19, we are not out of the woods, folks. Let's not forget that. And here are the numbers broken down by region. And again, per capita, the number in the lower left in the South is the most troubling number, I think, for me, at least on the page. Because you've got a lower population and 130. Again, we're not shocked. Judy has told us this is going to migrate north, central, south. You can see it's not out of the woods in the north or central either, but as a per capita matter, that's a big number in the South. I was on with Kevin O'Dowd yesterday at Cooper Health, and he's done an extraordinary job, the same job Sharif's been doing in the north, and Amy Mansu in the central part of the state, Kevin has been doing in the South. And we have to keep these numbers all going in the right direction. And by the way, it's our collective job to do so. Social distancing is working. Wearing a face covering is working. Washing your hands with soap and water is working. And remember these 8 words. Public health creates economic health, and data determines dates. Let's not forget that. And the more we keep this up, the better position we will be to confidently and responsibly get ourselves on the road back, and we can begin to restart our economy. Before you flip, I just want to say we had a very good call this morning, as we do every 10 days or so, with legislators from both parties. And we went through some of the steps that we're looking at potentially taking, or in fact are taking. But again, we reiterate, the faster we can break the back of the public health crisis, the faster it is that we can reopen our economy. And we will do that at every step, as we have, based on the data, the science, and the facts. Sadly, with the heaviest hearts, today we must also report another one. Do you need the mic on for the feed?
It's on. It's on.
It's on. Thank you, Judy. Judy's not only our Commissioner of Health, but she's also our Chief Technician, and reminded me that my microphone, in fact, was already on. So that's a light moment, but we're going to flip, unfortunately, sadly, to a very tough moment. Again, another 166 deaths we're reporting. That number from COVID-19 complications, that number now stands at 9,116 fatalities. 9,116 fatalities. It takes your breath away. I want to honor a few of those folks, but it doesn't look like we've got our, here we go. So let's remember several of those who have passed. First up, if we can, we'll go the other way. There he is, Geoffrey Lynn of my hometown, Middletown in Monmouth County. Jeff spent a career in purchasing logistics, most recently at Permapure in Lakewood. In fact, right up until he fell ill with COVID-19, Geoffrey was on the job procuring the supplies necessary for his company to produce tubing for ventilators. Jeff's family and friends knew him as an incredibly proud yet humble family man who went out of his way to make everyone around him feel welcome and to smile, whether with a silly joke or a funny story. He was a fan of both Frank Sinatra and Paul Anka. And for those of you watching at home, you may know that Paul Anka wrote Frank Sinatra's anthem, My Way, and he was often singing along with them at home. His daughter, Stephanie, who I believe lives in Philadelphia, summed up her father with these words, and I quote Stephanie, "He was the nice guy in the neighborhood, the sweet customer who regularly frequented Middletown shops, the chatty man in line at the grocery store. He made friends with any and everyone he met." He was, by the way, only 70 years old. He leaves behind his wife of 40 years, Carol, and please keep Carol in your prayers as she continues to battle. His two daughters, Stephanie, who I mentioned, and Victoria, with whom I had the honor of speaking. Stephanie, I believe, is in Philadelphia with her husband and with Jeff's grandson, who he also leaves behind. Victoria is in Middletown. Jeff also leaves behind a sister and other members of his family. We send them all our deepest condolences, and may God continue to bless the soul of Geoffrey Lynn. Next up, let's meet this guy. This is William Bill Schultz from West Milford, Passaic County. Bill spent more than 40 years within Sarah Supermarkets, and most of that at the ShopRite in West Milford. It couldn't have been all work, though, as it was there that Bill met his wife, right there with him, Denise, the woman who would become his wife 37 years ago. Together they would raise two children, Bill Jr., Billy, and Jennifer, and I had the honor of speaking not only with Mom, Denise, but also with Billy and Jennifer yesterday. And he took special pride in being with his four grandsons, Billy, Nicholas, Michael, and Jackson. And when he would babysit them on his day off from work, there was nothing better. Family was everything for him. Well, almost everything. Bill was also an athlete and a huge sports fan, especially of my team and I were trying to figure out how we got these together, of the Yankees and the now Las Vegas Raiders. He loved music, he loved to cook, he loved the shore, and he was just 62 years old, and his wife, Denise, went out of her way to tell me that he was in very good health. So this is an example that while this has been ravaging older folks, folks with comorbidities, folks in communities that have historically been left behind, it has been also unsparing, even with some of the healthiest among us. In addition to Denise, his kids and grandkids, Bill is also survived by his dad, William Sr., 5 siblings and their families, and so many friends and colleagues. His memory, his soul, and all of them are in our thoughts and prayers today. And finally, let's remember, on the left there, a giant, Lillian DeMarco. Lillian was 90 years old and lived in the Lake Hiawatha section of Morris County. Lillian was born in Newark and grew up in nearby Montclair. She got married to her late husband, Paul, in 1950, and in 1960 they moved to Lake Hiawatha, to a house Lillian would call home for the next 58 years. She was a proud telephone pioneer and spent her career with AT&T and Bell Telephone before retiring in 1990. Retirement for her didn't mean sitting back and taking it easy, however, and in her retirement, Lily traveled the world and volunteered her free time at St. Clair's Hospital in Denville, and she loved to read and to do word search puzzles. According to her family, Lillian was the happiest when she was spending time with her family and friends, especially if it involved a deck of cards or a set of rummy cube tiles. Lillian is survived by her 3 children, her daughters Catherine, who's known as Kitty, and Patty, and I had the honor of speaking with Kitty and Patty both yesterday, and her son Paul, in addition to their spouses and her 4 grandchildren. Likewise, we keep Lillian's memory and all of her family in our thoughts today. God bless you, Lillian. We remember Jeff, Bill, and Lillian because neither they nor any of the other 9,113 we have lost should ever be just a number. They were real people who lived real lives and who leave behind real families. They were each a treasured part of our New Jersey family. Our battle here is not just a battle to bring down the numbers, which it is. It is a battle literally to save lives. Remember that, folks. So keep practicing your social distancing. Keep wearing a face covering when you're out in public. Sharif and Rosie and others, Judy and Tina and their teams across our state are doing great work on things like developing therapeutics and cures. But the only surefire cure we have today, right now, is social distancing, staying away from each other. So please continue to do it. And by the way, we have led every single American state in doing just that, and we should all wear that forever as a badge of honor. Let's switch gears for a couple of announcements if we can. On Monday, the State Department of Education will launch an online application process for eligible districts to receive their shares of $280 million to cover the costs of purchasing educational technology, providing remote instruction, cleaning and sanitizing buildings, and ensuring support services for students who require them, among other, I might add, COVID-19 response-related expenses. Getting this funding flowing to our districts is a win for our schools, our educators, our students, and our taxpayers. I express my appreciation especially to the Education Commissioner, Dr. Lamont Repillette, and his team for working really hard to get this in place. I next want to give a huge shout out and congratulations to the team from Rutgers RU-CDR Infinite Biologics, who along with their partners at Spectrum Solutions and Accurate Diagnostics Labs yesterday received Federal Food and Drug Administration approval for the first at-home saliva-based test in the United States of America. This is a big step forward, and to know that it was made here in New Jersey with the support from our state's flagship institution of higher education is a great feather in our New Jersey cap. We all know that testing is a critical part of our getting on the road back, and the easier and more accessible testing is, the more secure we will be on that road. In fact, Monday, I think we're going to be able to do this on Monday. We're going to go through the whole testing plan going forward, Judy, and I think we've made another audible call at the line of scrimmage. I think we're now going to split testing and contact tracing because we think there's so much to go over in each of those respective areas that we're going to split them between Monday and Tuesday. I also want to return to a topic that I brought up on Wednesday, which is not COVID-19 related, but is of incredible importance to our state, and that is the census. Over the past 3 days, more of you have responded to our call to go to 2020census.gov to be counted, and our response rate has ticked up, but just a little bit, from 58.6% to 59.8%. We still, however, rank 21st of the 50 states, Washington, D.C., and Puerto Rico. I know we can do better. This map shows response rates across our counties. The darker the blue, the more of you who have already been counted. However, as the shades of blue go lighter, and in turn, shades of orange, these are counties that we need to see really start to step up. I'm going to return to this map occasionally, and I'll even point out some of the communities that are both at the top and bottom ends of the scale. But this is our starting point. Ensuring that every New Jerseyan is properly and accurately counted in the 2020 census is vital. The census is the data that the federal government and, quite frankly, we in state government use to make the decisions that impact every community in New Jersey. New Jersey was undercounted in 2010, and because of that, we have left literally billions of dollars in federal aid on the table over the past decade, and that undercount even impacts us today in our efforts to get more COVID-19 relief to our state. Folks, the money is there. If this money isn't coming to New Jersey, it's going to some other state like Kentucky. Let's make sure we get it here in New Jersey. So if you've not yet taken the time to be counted, please take a moment, go online to 2020census.gov and make sure you are. So much rides on an accurate count. Now, before I wrap, I want to give a couple of well-deserved shout-outs, but we're going to do things a little bit differently today. I want to give a big thank you to some folks who have been working directly with us in our response efforts, some in front of the proverbial curtain, and others whose work has been backstage, but in both cases equally as important. First, I want to give a huge thanks to the U.S. Army Corps of Engineers. Yesterday marked the Corps' last day with us, with regard to our efforts to expand our hospital bed capacity. In just 45 days, the Corps and the State Office of Emergency Management forged a partnership that assessed more than 20 healthcare facilities. Judy, you were at most of those. Designed, as was Pat, and designed and built out our 3 field medical stations. It was able to reopen mothballed hospital wings, erect a 100-bed medical tent in the Newbridge Hospital parking lot, and convert the gymnasium there as well into a temporary hospital. The direct help of the Corps enabled us to quickly expand statewide bed capacity by some 1,400 beds. Now, the Corps is not going away entirely. They will now return to the environmental projects throughout the state that they had already underway, and in those, we look forward to our continued partnership. So to the U.S. Army Corps of Engineers, its leader, Lieutenant General Todd Semonite, North Atlantic Division Commander Major General Geoffrey Milhorn, and Philadelphia District Commander Lieutenant Colonel Dave Park, and their teams, New Jersey thanks you. And to President Trump, I thank you as well for your swift response to our request to have the Corps deploy alongside us. I also want to give a big thank you to one of our corporate partners today, Microsoft. Throughout our response, Microsoft has worked alongside our Office of Information Technology to develop the healthcare volunteer signups in our hospital dashboard at covid19.nj.gov, and to automate the reporting processes for bed and staff management, supply management, and discharge details. In these efforts, Microsoft donated both licenses and hundreds of hours. So to everyone at Microsoft who's been a vital partner to our information technology team, New Jersey thanks you. So as I turn things over to Judy, I just urge everyone to keep doing what you are doing. Tomorrow, as Judy has pointed out, and I will today, is Mother's Day. And on a sad note, New Jersey lost one of its great mothers yesterday, Mrs. Betty Wold Johnson, at the age of 99 years old, the matriarch of the Johnson family, mom to both Woody and Chris. So to them and to the members of the Johnson family in New Jersey and around the world, Woody is now serving as our ambassador to the United Kingdom. Our thoughts and prayers are with you. The first time I met Mrs. Johnson, it was nearing the end of the first half of a Jets game, and as we know, the Johnson family owns the New York Jets. And I wanted to walk over and introduce myself, and the person with me said, I think it was Tim McDonough, said, she'll meet you at halftime. She never wants to be interrupted during the game. And I said, okay, that is a leader. That is a mom. So to you, remembering Mrs. Johnson, and to the Johnson family, our thoughts and prayers go out to you. But as a general matter, tomorrow is Mother's Day. And I know we all want to make sure we remember properly the women in our lives who have done so much and continue to do so much for us. But let's make sure we are celebrating them responsibly tomorrow so we can celebrate them again next year and the year after and for many years and decades to come. Happy Mother's Day, everybody. God bless you all. With that, please help me welcome the woman who needs to know.
You've been listening to Governor Murphy give an update on the coronavirus outbreak in New Jersey. We're now returning to regular programming on CBS 2. For extended local coverage, stick with our streaming service, CBSN New York.
This has been a special report from CBS 2 News. We now return to our regular programming.
Not stop the deliveries of our next generation. So we need to make sure that those deliveries are safe. The New Jersey Healthcare Quality Institute convened a work group of maternal and child health experts, which included the Department of Health staff, to develop recommendations to guide pregnant individuals and their providers during the COVID-19 epidemic. It provides specific and clear guidance aimed at providers to ensure that all pregnant individuals obtain safe and equitable care despite the social distancing and infection controls necessary to reduce the spread. The recommendations also are created to align with the work of Nurture New Jersey, which aims to reduce maternal mortality in New Jersey by 50% and to eliminate racial disparities in birth outcomes. We do recognize this is a challenging time for pregnant women and new parents in New Jersey. Pregnant women and their families should take all possible steps to avoid infection. The full report can be found at njhcqi.org, and I encourage you to look at. But here are some highlights. In-person medical visits should be minimized to the extent possible while maintaining patient safety. Patients should be encouraged to attend their visit, unfortunately, alone. Providers should develop a system for patients to wait for their appointment outside of the office to limit the number of individuals in the office at any one time. Prenatal education group classes should be encouraged and conducted via telehealth. Patients should receive education on what to expect when they arrive at the hospital, such as new triage procedures around labor support and discharge. Patients who are pregnant may be arriving to a facility due to an illness, pregnancy or non-pregnancy related. They could be complications, they could be in labor, or they could be scheduled for an induction or C-sections. All pregnant patients should be rapidly assessed based on the facility guidelines to allow the care team to provide the best possible and safe care. And if possible, all pregnant patients should be tested prior to or at the time that they present at the hospital. Additionally, moms choosing to breastfeed their infant should be educated on the precautions that they should take to prevent the spread of COVID-19. Again, for further recommendations, please go to the New Jersey Healthcare Quality Institute's report. That can be found at njhcqi.org. The Department of Health continues to support expectant mothers, children, and their families, and has modified many of its programs as part of the COVID-19 response. Telehealth is now used to provide doula support, home visiting, and the provision of critical early intervention systems. So May is Maternal Mental Health Month, and our partners have modified their operations to offer virtual support groups for our new moms. To access any of these programs, please call the Family Health Line at 1-800-328-3838. This morning, the U.S. Department of Health and Human Services announced the allocation plan for the drug remdesivir. They are delivering 110 cases to New Jersey. Each case has 40 vials of the drug. The department is working with the hospitals on a distribution plan that will be equitable and consistent to where the greatest need is. These supplies are part of the donation made by Gilead Sciences. Remdesivir is an antiviral that improves the time to recovery from 15 days to 11 days. That proves that this drug can block the virus. Now for my daily report. As the governor shared, our hospitals reported 4,628 hospitalizations and persons of COVID-19 and persons under investigation, and 1,416 individuals in critical care, with 74% of them on ventilators. The governor reviewed the new cases and deaths reported today. In terms of deaths, the breakdown by race and ethnicity, basically unchanged. White 52.5, Black 19.2, Hispanic 17.5, and Asian 5.3, other 5.4. There's 515 long-term care facilities in our state now reporting COVID-19 cases. At the state veterans' homes, among a census of 673 residents, there have been 362 that have tested positive, and we are reporting a total of 129 deaths of those residents today. Our state psychiatric hospitals are reporting 12 deaths today, and yesterday I reported the death of a 4-year-old with underlying conditions. We have no indication at this point in our investigation that the death was related to Kawasaki disease. The cumulative percent positivity rate is 37%. The New Jersey spot positivity rate as of May 5th is 27%. So that includes my daily report. Stay connected, stay safe, stay healthy, and don't forget to connect with your moms tomorrow virtually. And again, happy Mother's Day to all of the mothers out there. Thank you.
Judy, thank you for the report. The counties will be brief because we've got a number of speakers. The counties with the most positives continue to be the big six, and certainly the ones that are part of the commuting metro New York City reality. But let's remind everybody there are positive cases in every county, and there are fatalities in every county. I'm just wondering if we can petition the manufacturers of remdesivir to change the name to something like pill. We could roll off the tongue here a little bit more easily. With that, again, I mentioned this kiddingly earlier, but the two folks to my right have walked in each other's shoes. When Sharif was the commissioner of the Department of Health, we really needed to stabilize University Hospital, which is one of the most important hospitals in the entire state and directly controlled by the state. And there was only one person who could do that, and that was Judy. And Judy did it on a temporary basis, and as luck would have it, University Hospital, when they searched not just the state, the country, or the world, and came up with their preferred new chief executive officer, it was Sharif. Which then allowed Judy and I to get together in a different way, and for Judy then to succeed Sharif. So this is of some version of the Lion King circle of professional life. And with that, again, I can't thank him enough for his leadership. We're going to talk for a few minutes about plasma today, but Sharif has also been the coordinator, as I mentioned earlier, for Judy in the North region, and that's where this thing exploded first and where its toll has been the heaviest. And we're first going to hear from Dr. Sharif El-Nahal, who's the CEO at University Hospital, and then I'm going to turn to my left and hear from Rosie Taravella, who's the CEO of the American Red Cross New Jersey region. Sharif, up to bat. Thank you, man.
As the regional coordinating hospital for Northern New Jersey, we're thankful for the opportunity to collaborate with the Department of Health, State Police, National Guard, and the Army Corps of Engineers to set up the field medical station in Secaucus. This has been a very successful strategy to provide relief during the peak of this surge for Northern New Jersey hospitals. University Hospital has been operating a 24/7 medical command center to coordinate admissions of patients to the FMS Secaucus. Over the past month in Secaucus alone, we've worked with over 58% of the hospitals in Northern New Jersey to admit 268 patients, saving those hospitals over 1,100 inpatient days. That means much-needed bed space for more seriously ill patients in the hospitals that we served, while providing top quality care to the folks that went to Secaucus. Our Medical Command Center is an invaluable resource to the state, fielding thousands of calls and facilitating all patient transportation in the region during this time. This team did over 2,200 phone calls to date, which averages almost 80 per day. Although we had to plan for it, I really want to mention this and emphasize it. We thankfully did not have to ration care in the northern region at any time during this pandemic, even during the peak. That is not an accident. And Governor and Commissioner, I want to say that as a direct result of your efforts, the stay-at-home order, the Commissioner's organization of all of the hospitals in the state to respond and expand capacity, the Colonel and the state police efforts to allocate PPE and ventilators from the national stockpile, that is what got us through this. We're also leveraging our status as an academic medical center, working with physician scientists at Rutgers, New Jersey Medical School to research promising therapies and testing platforms, including trials involving remdesivir, azithromycin, and other antiviral therapies, including monoclonal antibody therapies. University Hospital is among the first in New Jersey to get FDA approval to provide a novel therapy that may be the most promising of all options to date, convalescent plasma. And Governor, you may recognize the individual beneath the mask across the room. We want to thank Chief Counsel Matt Platkin and all the many individuals who've stepped up in our program after recovering from coronavirus to donate their plasma. I also want to give a shout out to the New York Blood Center, which has helped us get a lot of the plasma to date. We never stop looking for cutting-edge opportunities, and today I'm proud to announce our latest partnership with the American Red Cross to host a convalescent plasma donation site on our University Hospital campus in Newark, New Jersey. This site will open this Monday, and we're already reaching out to interested donors to make these appointments. I want to thank the Red Cross New Jersey Regional CEO Rosie Taravella for her support. This will increase access to plasma donation opportunities for Newark, the surrounding region, and significantly increase capacity for plasma donations across New Jersey. In other words, more patients in New Jersey will be able to get this therapy because of this new site. The effectiveness of this treatment is not yet known, but many patients that have received this therapy at University Hospital have recovered, which is a promising sign, and importantly, we're leading a study that will help determine the efficacy. Governor, University Hospital thanks you for your leadership during this public health emergency. Commissioner, for your leadership as well. It is our honor to answer your call to serve our fellow citizens throughout the state. As with crises that New Jersey's seen before, including September 11th, Superstorm Sandy, the Ebola threat, and others, University Hospital has been and always will step up to meet the challenge on behalf of Newark and the people of New Jersey. This is why public hospitals matter. Remember, COVID plasma at uhnj.org, and the phone number is 973-972-5474 if you recovered from coronavirus and you're able to donate. Thank you.
Sharif, so well said and so well done. Thank you for your leadership on this and across the waterfront here, particularly in this crisis. It takes a village, and we could not be doing this. The state couldn't be doing it. University Hospital couldn't be doing it without the cooperation and support and leadership of the Red Cross. So please help me welcome the CEO of the New Jersey region of the American Red Cross, Rosie Taravella. Rosie, great to have you.
Thank you, Governor. The American Red Cross has adapted to meet the extraordinary challenges of the coronavirus epidemic and the fulfillment of our life-saving mission to alleviate suffering as we confront an emergency unlike any we've seen in a century. 4 weeks ago, the American Red Cross and other blood collection organizations joined the U.S. Food and Drug Administration's efforts to support the collection and distribution of convalescent plasma, a potentially life-saving treatment for critically ill COVID-19 patients. Together, we have worked around the clock to put this new initiative in place by establishing a process to identify, qualify, and collect convalescent plasma safely from recovered COVID-19 individuals, both at the Red Cross and at other blood collection organizations around the country. Last month, the first Red Cross collection of convalescent plasma took place right here in New Jersey, and according to media reports, the 2 recipients that the plasma was given to have been discharged from the hospital and are in a rehabilitation center to complete their recovery. To date, the Red Cross has distributed more than 1,000 convalescent plasma products throughout the United States and is projected to collect and process a couple thousand more this week. We continue adding resources to qualify more donors, which will help increase collections. And I'd like to thank Governor Murphy for his insight into this treatment's potential, his concern for the people of New Jersey, and for taking action to bring the American Red Cross together with University Hospital in Newark for this partnership to help increase the collection of life-saving plasma. We look forward to working with Dr. Elnahal and his team at University Hospital, and we encourage other hospitals to join the FDA's efforts to combat the effects of this disease. The Red Cross encourages individuals who have fully recovered from COVID-19 to sign up to give convalescent plasma by completing the donor information form on our website, redcrossblood.org/plasma4COVID. That's the number 4. If the individual is eligible to give, a Red Cross representative will contact them to schedule a donation appointment at a Red Cross or at another blood collection facility that's near them. Please note that plasma is collected by appointment only. Each day, we're making strides to get more donors in the door and more products to patients. We're working with the FDA and hospitals to identify the scope of patient need in this rapidly evolving environment. Partnerships such as this one with University Hospital will help. Plasma can be frozen for up to a year, and so we encourage fully recovered COVID-19 patients to donate to help build up a sufficient supply of convalescent plasma that can easily be readily available for hospitals going forward in the region and beyond. In this time of crisis, the Red Cross is privileged to witness the best of humanity as people roll up their sleeves to help those in need. We greatly appreciate the support of the American people and those recovered COVID-19 patients who have stepped up in an effort to help someone during this extremely difficult time. To learn more about this life-saving effort, again, please visit redcrossblood.org/plasma4COVID. Thank you.
Rosie, thanks to you and to your extraordinary team at Red Cross in the New Jersey region for your, not just your help here, but leadership. And it's great to have you with us today. And Sharif, likewise. Pat, before you jump in, we made history today. For the first time in the history of the Wall Street Journal, my name, the word knucklehead, and the Three Stooges were all in the same article. And so it's in that spirit I ask you to update us on compliance, PPE, infrastructure, and other matters. Thank you.
Although it was relatively quiet, I sadly have to report an additional one in that category. Thanks, Governor. Good afternoon. In Newark, overnight, Newark Police Department issued 33 EO violations and closed 1 non-essential business. And really the only other event was also in Newark at a store where a store manager and cashier got into a verbal argument with a customer over the price of an item. And when the woman was escorted from the store, she spit on the store manager and on the cashier. The only other thing that I would add, Gov, is just, and I know I've spoken of it before, is the National Ambulance contract that's due to end on Friday, May 15th. We still have 10 basic life support and 10 advanced life support in use for 1 more week. But in the time that they've been here, they've answered more than 10,500 calls for service, including more than 350 cardiac arrests. So just a phenomenal effort that did a tremendous job in alleviating the stress on our EMS providers. Thanks, Gov.
Pat, thank you. A couple of housekeeping matters. We're going to start over here with John. Do you have a question, sir, against the wall? Are you good? You good? Yeah, you're good. We'll start with John. I can't with these masks. It's one of the prices you pay is you can't see. We're not there yet. Hold on, Dante. Again, just to go over a couple of items. Matt will correct me if I'm wrong. The census deadline, back to the census, has been moved from August 15 to October 31. And so that's an important point. We still have time. I said to my team over the past couple of days, I want to be a top 10 state. That may be a stretch in terms of compliance, but we've got to overperform here. This directly relates to federal money that we get, including money in the here and now battling COVID-19, never mind the past decade of money that we left on the table. Secondly, we will be virtual tomorrow, unless you hear otherwise. Mahan or Dan will get a hold of you if that changes, but we'll be virtual. We'll communicate with you electronically tomorrow. We will be together, although there is a White House VTC, we're still going to try to do this at 1 o'clock on Monday. And I'm happy and honored to say that Senator Bob Menendez will be with us. And that will be, actually, we're still trying to figure out whether we do testing and contact tracing, as I said earlier, because Judy and I have both concluded these are both big topics to discuss, whether we do them separately or together. Now, even since I said that, I now lean right now toward focusing on federal support on Monday with Senator Menendez, if he's here, and then maybe doing testing and contact tracing together on Tuesday. But bear with us on that front. But again, tomorrow is virtual only. John, you're up. Let's keep these pretty quick, and we get you out of here. Thank you.
Yeah. Can we get updates? We'd asked for a COVID case data by zip code. Any chance of getting that soon? And any update on site visits by the Department of Health inspectors at long-term care facilities? Is that still continuing? Is there any thought to intervention or any steps being taken at the New Lisbon Developmental Center, where there are over 300 positive cases? And Governor, earlier today, New York announced an investigation into the pediatric disease associated with COVID-19 after saying 3 children died in New York State of that. Any indication in New Jersey of such cases? Any indication that there's hospitalizations or deaths associated with that?
Thank you, John. My guess is we're not there on COVID. You mean positive cases or fatalities by zip code?
Anything by zip code.
Zip code. Let's come back to you on that, because I don't know that we've got that, so we'll come back to you if we can. Judy will update us on long-term care site visits, as well as the new Elizabeth Center. And Judy, I know, wanted to say this blessed 4-year-old who passed yesterday. I don't want to put words in your mouth, but we got a lot of, hey, was the underlying health condition Kawasaki? And to the best of our knowledge, and Christina was part of this, the answer is no. It was another comorbidity, and we're going to leave it there for privacy sake. Judy, you may want to just as well address Kawasaki again, and how concerned we are, and any steps we either are or consider taking. So, and we'll come back to you in the zip code question, if that's okay, John. Please.
On long-term care, the site visits, the surveys are continuing. We had some difficulty with PPE at the beginning of the week. But that's primarily the mask, but that was taken care of. The latest count I have, and it's higher than this, but the latest count I have, which is at the end of last week, there were 54 infection control focus surveys, 1 specialty hospital survey, 1 dementia care home survey, 5 assisted living, 47 nursing homes. On the developmental centers, as you know, we're doing universal testing in the developmental centers. All residents and staff at the 5 centers have been tested, and we're moving on to congregate settings. That's the latest I've gotten from the Department of Human Services.
The specific location, if we've got any more color, Mahan, we'll come back to you. Is that okay? Thank you, John. Brent, good afternoon.
Good afternoon. Going back to the 4-year-old, we've now had, that story sparked dozens and dozens and dozens of parents being like terrified that now is my child going to die? And, isn't in the interest of public health, not to reveal who the child was or where they're from, but more about what happened there. Can we get anything else? 2, long-term care facilities obviously are a big deal. And do you feel that there's more you guys could have done to prepare for this at these facilities? And 3rd, and final, a new report shows there may be thousands of suicides because of unemployment and lockdowns during the pandemic. Are you tracking suicides, and is that something you're considering when it comes to how we reopen, if that's another number you're factoring in?
Judy, may I start?
Sure.
Is that all right? I'm going to say this at the risk of, on the 4-year-old, this is a very specific situation with this blessed little kid, and we're going to leave it at that. And if it were something other than a very specific situation, we would have the burden of responsibility to say so. Long-term care facilities, I don't know any place in America that would wish, upon reflection, that if only, it's just that this has been, you see the loss of life. Just to repeat that the 2 things, the performance by the operators has been extremely disappointing, not in every case, but in too many cases. Uneven, disappointing, lacking in communication, lacking in some basic blocking and tackling. The second thing is that we have thrown now an enormous amount at this. Judy began that months ago at this point. The Attorney General is investigating. We've plussed up with a nationally recognized team to further help our efforts. The National Guard is now in these facilities, not in all of them, obviously, but beginning in a number of them. When we do our national postmortem, when we do our own postmortem in New Jersey, a huge focus will be on long-term care. And part of the reason why Judy's hired the team that she hired is not just to help us in the here and now, but to help us in the medium and long term on what this industry has to look like to achieve a more satisfactory and more consistent performance. Last thing I'm going to say, Judy, I'll turn it to you, is, I don't know specifics in terms of tracking suicides, but we have said this, that the combination of isolation and now other factors like job loss are having big impacts on folks. There's no question about it. I think for the overwhelming folks, particularly those who don't have mental health challenges and who still have a job, there's been a spirit, as we've talked about, of coming together. But this is a healthcare crisis unlike any we've ever seen before. On top of that, an economic crisis unlike any that we've never seen before. And if that weren't enough, the cure for the health crisis is keeping people isolated. We know that that's social distancing and staying at home. We know that's what the doctor has ordered. But you add to that job loss, small businesses that have been crushed. It's a toxic mix, and we're not an exception in New Jersey. We have that challenge just like anywhere else where it's been hard hit. Judy, any of the above?
I think we are concerned about mental health issues. I don't have the tracking of suicides, but as you know, we've reminded individuals repeatedly to call the hotlines. We do monitor the calls to the hotlines. One of the reasons the governor gave for opening up our parks was to allow people to get outside because the emotional well-being of people in isolation was a concern. So it is a big issue, and we will continue to monitor it and encourage people to seek help for sure. On Kawasaki, I can imagine that mothers are concerned. I just suffice it to say that the individual, that, like the governor said, the poor blessed little soul, that individual did have a significant underlying condition. And it obviously complicated the situation.
Thank you. Sir, you good? You good? Charlie, I got you. Thank you. Christine, I was almost going to call on you, and I realized it was you. Apologies. Charlie, how are you?
I'm well, thanks, Governor, and happy Mother's Day to all the mothers, including
Likewise.
my own. So you appointed the Restart and Recovery Advisory Council this week. How does that fit in with the Restart and Recovery Commission that you appointed on April 28th? Are the members of these bodies New Jersey residents? And how, if at all, will they work with Craig Coughlin and George Zoffinger's advisory panel to assist recovery? You signed EO 132 about initiative and referendum petitions. Does that also apply to recall petitions? Surely if you don't want people circulating one kind of petition, you wouldn't want them circulating another kind. Is that covered, or is there another executive order necessary to make those electronic petitions possible for recall? And then finally, from the Health Commissioner, if I could just get an update on the EO 111 data. I still haven't gotten any from Robert Wood.
Which one is that again?
The daily data, capacity, and supplies.
The daily?
The daily data on capacity and supplies that was Executive Order 111.
Judy, I'll start, and you want to come in behind me? Is that all right? So the council versus the commission is, and I've said this, I think I've said this, the commission is largely strategic, high-level guidance. That's not to say that they're not going to have an opinion on very specific tactical steps we may take. And these are folks who have a combination deliberately of New Jersey, national, and global experience for a reason, from different perspectives. There's no one person on that group of, I think with the at-large members, about 20 people, there's no one person on there that really duplicates an experience or perspective of another one. The councils, which we announced yesterday, is split into 9 different, what I would call largely tactical groups. Again, that does not mean that they're not going to have likewise strategic thoughts and input, and we welcome that. But they are going to be specific to transportation and infrastructure, tourism, social services, and faith-based. There's 9 different groups. They are overwhelmingly, in this case, if not entirely, New Jersey folks. In fact, I'm going to go out on a limb and say I believe they are entirely New Jersey. I'm not sure necessarily resident in every case, but their experience is. And that's a deliberate distinction between largely strategic, largely tactical, and we need them both. And the group, the commission, the first strategic group is co-chaired by Dr. Shirley Tillman, President Emeritus of Princeton, and Ken Frazier, the CEO of Merck, and it's a terrific group. The councils are co-chaired by our Secretary of Higher Education, Dr. Zakiya Smith-Ellis, as well as by CEO of the EDA, Tim Sullivan, and the CEO of Choose New Jersey, Jose Lozano. All of the above, including yours truly, will work both, and it's not just the speakers group, but the Senate President has put a group together as well. And we have already begun our interaction with both sets. I can't say for sure what that interaction will look like, but we have all agreed wide open communication, cooperation, not competition are the watchwords, and so far that's worked out quite well. I have no color on either of the EO questions you asked, but I will ask Matt Placken to, bless you, to tell us whether or not EO 132 includes recall petitions. And my guess is we'll want to get back to you on EO 111 unless you've got anything you want to add there. So EO 132?
Does not include recall petitions.
And EO 111, do you have any more insight, either you or Judy?
I think we make the data available. The data that's presented every day is based on data that's submitted from EO 111.
We'll come back on the EO 111. So the answer on 132 is definitive. It doesn't. And then 111, we'll come back. We get more color. No, haven't thought about it, but thank you. Sir, how are you?
Good. How are you, Governor?
Very well.
I wanted to ask you if the Guardsman deployment includes the new Lisbon Developmental Center. Have you contacted the mayor of Woodland Township yet? He says we need to fix this situation. Also, I was curious if the health commissioner could detail what might be behind South Jersey sort of lagging behind just a little bit. And also, has there been any consideration to adjusting the minimum wage at all during the economic crisis in either direction? And the last thing is, when might we hear from Commissioner Johnson here at these briefings regarding the developmental center situation?
Okay. Judy, I'll jump in and please come in and correct the record. I have not spoken with the mayor about this, but I will make sure, Brady, you're going to have me, you'll go to Mike Delamater right now. We'll reach out to him literally as we're sitting here. So if you could do that right away, that'd be great. And in terms of more details on that, I think we'll come back to you separately. South Jersey, I think, is the reality that this thing exploded as a Metro New York City reality, and everyone's written about that, and I'm sure they'll be writing about it for the next, I was going to say decades, my guess is century or more. And the counties that were crushed earliest and have been crushed the most are the big commuting counties into New York City. There's no other way to put that, really. But Judy reminded us, and she can put this in her own words, from day one that this would migrate. not just around the country and around the world, but within our state. And there was a time, Philadelphia appears to have gotten this behind it, where Philadelphia was being highlighted as a potential next hotspot. And it never exploded, thank God, at the level that New York City exploded. But the combination of that, I think, it has played out as we had expected. And as I said, the number today that we're reporting, other than the blessed souls we've lost, that gives me the most cause for concern are the number of new hospitalizations in South Jersey, because per capita, that's a higher number. No consideration on minimum wage one way or the other. It is what it is. It's on the path that it's on and will continue to be. And on Commissioner Johnson, it's a good point. She's been here, as you know. It's a good suggestion potentially to have her back, but maybe Mahen, you could get a direct connection with her to talk about some of the questions that you've got in the absence until she gets here. Judy, anything you want to add?
Just on the South, we're beginning to see the flattening and decreasing of the cases, 10% down from the beginning of April. Just as a comparison, Central region is 37% down, and Northern region is 56% down. So the migration is exactly the way the governor represented it, and just the population base in South Jersey is so much smaller than Northern Jersey. So good news all around, though, with the hospitalizations.
And again, we'll get back to you on the developmental center. Mahen, you'll make sure that happens. And you're going to Mike to get to the mayor right now. Thank you all. So I want to thank, again, a distinguished group of colleagues, and I'll mask up as I do this. Rosie Taravella, immediately to my left, the CEO of American Red Cross New Jersey region. Rosie, thanks for being with us, and thank you for your leadership. Dr. Sharif El-Nahal, the CEO of University Hospital. Great to be with you again, pal. We miss you, and we've been with you in spirit, even though we've been social distancing with you. As always, Judy Persichelli, our extraordinary health commissioner, Dr. Christina Tan, state's epidemiologist, the one and only Colonel Pat Callahan, thank you. Team Maples are here in size, so Jared and Mary, thank you both. Matt, listen, the weather is better today than we thought it was going to be, even though it's cold. So remember, keep your distance, do the right things, not just generally, but specifically in state and county parks, as well as if you're golfing. Happy Mother's Day to every mother in the great state of New Jersey, and thank you, mothers, for everything you do. Again, we'll be with you virtually tomorrow and in person on Monday at 1 p.m. unless we tell you otherwise, with Senator Bob Menendez. We're honored that he'll be with us, and bear with us as Judy and I figure out whether or not we've got too much to cover already on Monday versus Tuesday on testing and contact tracing. We continue to assess actively other steps that we can take to responsibly reopen. That's a big reason why we've got these councils and commission to give us advice on that front. Most importantly, remember that the person on my right and her team will be the primary inputs here. Remember, public health and personal health creates economic health. It's in that order. And that data will determine dates. So folks, I can't thank you enough for being extraordinary in your compliance and social distancing and staying at home. We know it's not fun. Hang in there. Slowly but surely, we are winning this. We will get back on our feet, and we will be stronger than ever before. Thank you.